Hey everyone, and welcome to the review for the Non-proctored Module 1 exam. This exam is pretty straightforward. If you've been following through with your readings, watching the lectures and the PowerPoints, you should be good to go. I will say the PowerPoints have a lot of information in them, all of which are very important to you, but hopefully this review will help you narrow things down. So the exam is a 30-minute multiple choice exam. You have about 75 minutes to do the exam. Did I say 30-minute, 30 question? The exam is open book, notes, course resources, but please do not work in groups to do this. I don't think that puts anyone at an advantage. So try to do your own work and get through this exam. You guys should be just fine though. So let's start with the beginning. So we talked about assessment a little bit in this course. So here are a few things that you guys should really focus on as far as answering questions for this exam. So understand the different locations of auscultation and how it contributes to assessment. So this is pretty straightforward. We're not going to ask you a respiratory, well, these are kind of respiratory 101 questions, but they aren't going to be like, where do you auscultate X, Y, and Z? Just a general question about listening to the lungs. Identify different percussion tones and their associated findings, so dull, resonant, so on and so forth, and what do they mean? Consolidation, hyperinflation, and then we're going to ask you to identify 4 traditional vital signs as well as auxiliary measures. So what are the 4 traditional vital signs, and what might be one that we don't consider within those 4 but is very important to us? Understand the association between metabolic demand and suspected assessment findings. So when you have a patient with increased metabolic demand, what do you usually see with these patients? So you'll see hyperventilation, you might see hypoxia, you might see a high heart rate, things of that nature. So when we have a high metabolic demand, we have a high oxygen demand. So just understand how those two things go together, what you would expect upon assessment and seeing this, how this would affect maybe their oxygen consumption. We talked at length about the transport of O2 and CO2. We've done this in your last semester, and we touched on it again this semester. So I'm not going to spend too much time reviewing this information. But we talked at length about the role of hyperventilation and how it affects hypoxia and hypoventilation. So ventilation does play a pretty significant role in developing hypoxia or managing hypoxia as an extra measure. So understand those concepts and how our ventilatory status or our ventilatory drive can affect our oxygen consumption and oxygenation. There's many manifestations of hypoxia. So they're all in the Shedley text, so you should review those as well. So like histotoxic, alveolar, so on and so forth. Be able to perform the following calculations. So as far as calculations go, it's not too bad. I'm going to ask you to calculate the PaO2. Remember, the PiO2 is just the first half of that equation. Minute ventilation is a pretty straightforward calculation, and then your physiologic dead space. And these are all things that we've touched on in our associate degree program. So again, this is just a review and more or less a conceptualization of how to apply these things. We talked at length about VQ mismatching or matching in general. So just understand how we derive this ratio, the distribution of VQ matching across the different areas of the lungs. So in essence, we're talking about the West lung zones. So zone 1, zone 2, zone 3. How does the VQ ratio change throughout that range? And what's the average VQ? So basically the summation of those zones and then divided by 3. Be able to understand and interpret both shunt and dead space through VQ numbers or interpretation. So what is shunt and what is dead spacing as far as this goes? So always remember, this is ventilation, this is perfusion. So what does shunt mean? What does dead space mean? This review is not meant to reteach you this information, but should just more or less triage your studying. And then acid-base disorders associated with VQ mismatching. What would we see if we had a patient that was hyperventilating and air trapping? What would we see with a patient who had a metabolic acidosis and things of that nature? So we're going to talk about acid-base disorders and balance. It's going to be very straightforward, very simple. ABG interpretation, you're going to have to understand the anion gap and that calculation. You're not going to have to uncover 3 different derangements within a patient. So don't go too crazy on that, but I really hope that you understand that information, or at least are interested in that information as far as taking care of your patients. So know the finite number of possible disorders that can occur at one time with a patient, the anion gap and the normal range. So remember we said the normal range, we're saying 12 plus or minus 4. So think about it within that range. And you'll have 4 options for that. So it should be fairly obvious. General ABG analysis, so you're going to classify the state of compensation, the derangement, and the degree of hypoxia. And then the causes of metabolic acid-base derangement. So I allude to the mud piles. Acronym, mnemonic, not acronym. The mud piles mnemonic for different things that can contribute to a GAP acidosis. These are all in my slides as well as the book. We did a big thing on laboratory studies, so I wanted to narrow that down for you. So just recall the normal values for these electrolytes. And again, these should be pretty straightforward. Remember I said sodium, you can think of PaCO2. So PaCO2, that's normal, it's 35 to 45. Normal sodium levels in the blood are 135 to 145. Now your normal potassium levels, remember this is mostly intracellular. So if you ever get confused, always think that it's going to be a lower concentration outside the cell. The same thing goes with magnesium. Remember, calcium comes in ionized and unionized varieties. We like to measure the ionized version because that's the active form of calcium. Increased binding to albumin or other proteins that float around our blood can affect this measurement, and also our serum concentration. And then chloride I like to remember as a PaO2. So what's your normal PaO2? Add 100 to that and you should have your normal chloride levels. What clinical manifestations and causes of electrolyte imbalances? And again, this is reviewed in my lecture. The main thing you have to understand is just think of it as either your kidneys aren't getting rid of it, or they're getting rid of too much of it, or you're not getting enough of it in, as in like nutrition wise, or we're messing around with your body water. So when you think of sodium, how do we treat these electrolyte derangements? Most of the time we're going to treat the underlying disease process. We will correct electrolytes for the most part. Remember, usually slow and steady, but this isn't going to be an in-depth analysis, so just understand how we would generally treat these electrolyte derangements. And again, these could be all found in your text and in my lecture. Understand the normal values in the CBC with diff. So you're going to look at your white blood cells, you're going to look at your neutrophils, all that other fun stuff. So understanding those normal values will help you with this exam. I would focus on your hematocrit, hemoglobin, white blood cell count, and then your diff with your white blood cells. That's the most important parts, and platelet. So understand how platelets function, as well as a general understanding of the coagulation cascade. I'm uploading the lecture now that goes over that in significant depth as far as for this exam. We could go on for days about stuff like that. And then identify specific tests for administered anticoagulants. So how we monitor Coumadin therapy, so INR. How we monitor heparin. Well, we can look at the APTT. We can also look at the anti-10A. We can look at other parameters, but APTT or INR for these two right here. So just understand that, and this is a pretty specific breakdown. All right, it's going to be a very easy exam for you guys if you're using your notes, your books, and I think this is a lot of review as far as being a respiratory care provider, but some of the information I think, especially the coagulation stuff, is pretty interesting. Some of the other information I think that you guys should have no problem with whatsoever. So please reach out to me before you take the exam if you have any further questions. Use your resources, kind of skim through your books and the chapters and make notes so you can get to things pretty quickly, and good luck. All right, you guys should do great, and feel free to set up a time to talk with me through the Google Sheet link that I provided in the announcement for this week. All right, thank you.